friend, this is Mai with Creative Vibes, and today I want to talk about some of the most common misconceptions I encounter about music therapy. So let's just jump right into it. Number one is that all musicians are music therapists. Now, of course, anybody can be a music therapist with the proper training. However, I get a lot of comments online and in real life about people doing music therapy without having the proper training or education or credentials. And the reason why this is so important is because you can cause a lot of harm if you're running music therapy sessions without understanding what you're doing. You know, you wouldn't want a heart surgeon operating on you if they just picked it up from YouTube. You wouldn't want a therapist working with you if they don't have the proper field experience. So similarly to that, you don't want to market yourself as a music therapist if you don't have the proper training. Not only could you potentially cause harm to someone you're working with, but you can cause harm to the field of music therapy. And now, some of you might be asking, how can music be harmful? Well, here's a situation that actually happened to me. So when I was 15 or 16, I was doing a lot of performing in assisted living and memory care facilities, and one of the songs I would do frequently was You Are My Sunshine. And one time I was doing this song when all of a sudden one of the audience members starts screaming at me and crying to the point where we just had to end the performance right then and there. So come to find out, this was most likely a trauma response, and there is something in the song that triggered that. So if you're not trained in music therapy, you're not gonna know what to do. At that time, I was totally frazzled, completely taken aback, because I didn't realize that, sometimes music can be harmful because it is so tied to our emotions and our memories. This is something that I see come up frequently in substance use disorder treatment, where certain songs might be associated with their drug use and can be triggering for them. Sometimes that's even a goal that we work on together, which is putting a care plan in place when they do encounter that song unexpectedly. So if I were to revisit this experience now that I've had all this training, I probably would have noticed the signs that this individual was becoming triggered before the outburst happened. And even if they did still have that response, I would be able to A, move them towards a more calm or relaxed emotional state, or B, focus on the rest of the group's experience and maintain the atmosphere we had created while allowing the individual the space to experience what they needed to experience. So, please, I am begging you to stop calling yourself a music therapist or the activities you're doing music therapy if you don't have the proper training or education. Again, you'll need at least a bachelor's degree in music therapy. There's a 6-month internship or a minimum of 1,200 supervised clinical hours, and you also have to pass the written exam. There are no shortcuts. There are no certification courses online. There's none of that. Number 2, music therapy is just listening to music and being healed. I truly wish it were that easy. I feel like the whole world would be radically different if that's all we needed to do. And while listening to music is definitely a great therapeutic tool, we utilize all aspects of music to achieve whatever goals we might be working towards. Most of the interventions that we as music therapists use fall under 4 main methods. Recreative, which is using client-preferred music to engage in active music making. Receptive, which is using client-preferred music to engage in music discussion and receptive listening. Improvisation, which is using improvised music to encourage expression and collaboration. And composition, which is creating or rewriting songs personalized to the group or the client's journey. Again, music therapy isn't the type of therapy that's going to fix you or cure your cancer. However, it can make life just a little bit easier or help it make a little more sense. And last but not least, number 3, certain types of music are more therapeutic than others. So this can be true, but it really depends on the person. Client-preferred music will always be more effective than non-client preferred music. There hasn't really been any research that shows that any certain BPM or type of music is more effective than others. And being able to just like prescribe music is a nice thought, it's a cool ideology, but it's yet to be proven. I genuinely believe that music therapy is so effective because of the emphasis on client-preferred music, on giving the individuals a voice in their experiences and working with them. So, these are the 3 most common misconceptions I encounter in my life as a music therapist. Hope that was helpful, and feel free to ask me more comments or more questions in the comments. Thanks for watching. Don't forget to like and subscribe, and I'll see you next time.